The need for healthcare staff and consumers to access independent advice on specific health and care interventions and to implement evidence and evaluate its impact has been recognized globally. However, current efforts to do this are limited. Now, thanks to an exciting initiative by the Joanna Briggs Institute, the quality of health and aged care is set to improve.
There, that feels better?
Aye, it is a bit better, but it still hurts. It should get better soon. You seem to know a lot about these kind of things. Do you study hard?
Well, I try to. But you know, there's just so much new information comes out all the time. Yeah. It's hard to keep up. And I've got so much paperwork to do. Good girl.
So she has trouble swallowing, even sips of water. I am not familiar with the guidelines for that. Put her on new orally and let me do some searching, and I'll call you back, okay? Bye. Swallowing problems. So many different guidelines. I just don't have time to read all that.
Chris, have you been doing the exercises every day like I showed you?
Sometimes I forget. Does it matter anyway?
It matters a great deal. It can be the difference between you being able to go to work or play with the kids. There's lots of research to prove it too.
Oh, is there? Is there any information I can read that I can understand?
Yeah, I'll see what I can do. Just lift that arm up again.
Our post-operative surgical site infection rate has not gone down over the last 3 months. After all that networking, meeting, and report writing, what's going on? If we don't know our policies are based on best evidence, how can I help promote quality improvement? I need resources to help evaluate our systems.
Healthcare workers and consumers all have to negotiate an ever-increasing range of complex information, including research findings and guidelines. Deciding which of these lead to the best outcomes is a task that is becoming very difficult to achieve. The Joanna Briggs Institute has created an online resource to take the hard work out of best practice in health and aged care. The Joanna Briggs Institute is a world leader in reviewing healthcare research and evidence and making it meaningful for the people who use it. JBI COnNECT combines resources and tools to assist healthcare consumers and healthcare providers, including nurses, carers, managers and owners, allied health practitioners, and general practitioners. JBI COnNECT contains a series of nodes, or health specialties, that ensure the right evidence is available to the right profession at the right time. JBI COnNECT provides simple, quick access to the latest information on a huge range of health and aged care issues, as well as software tools to improve practice.
JBI COnNECT gave me the latest information on the treatment of Lorna's ulcer.
She changed the dressing to a new thing. I've had this pain for a year, but in 3 weeks it's gone. Now I can walk again.
And since then, our organisation has updated our wound care procedures to reflect the best evidence from JBI COnNECT. Now we can be sure that all our clients are receiving the best care possible.
So do that until I can come in later today to do a full assessment. Thanks. JBI COnNECT gave me a useful, up-to-date summary of what I needed when I needed it. I don't have time to search dozens of separate pieces of information every time I need to know something. It helps that the facilities I visit also use evidence summaries and best practice information sheets from JBI COnNECT. We're all working with the same information.
Mark gave me an information brochure from JBI COnNECT that helped me see why I needed to do those exercises. After all, I just wanted to know why it was so important.
JBI COnNECT helped us reduce our post-operative wound infection rates. We've comprehensively audited our perioperative practices using the JBI PACES audit software and made a lot of changes to what we do. And now we're using JBI Pool to continuously measure outcomes. I can see trends before they become a problem and compare our outcomes with other facilities. We're doing really well.
JBI COnNECT provides access to evidence summaries containing the latest information to guide best practice. Best practice information sheets give busy clinicians the information and recommendations for practice they need based on rigorous reviews of research. Evidence summaries are individualized to meet the needs of different provider groups. Consumer information sheets help healthcare users be informed about their care and treatments. Procedures, also called care bundles, have been researched so that they comply with the best evidence. Even better, they can be incorporated into organizational practice manuals. JBI PACES is an online audit tool that takes the hard work out of auditing and creates a structure for changing practice. JBI Pool allows healthcare organizations to benchmark against other similar organizations with full privacy and anonymity assured. JBI COnNECT brings a world of evidence to the point of care. It's simple. Get online, get the evidence, get it into practice.